Hi guys, welcome. My name is Bree Kimberling. I work in community health and wellness at North Kansas City Hospital, and we have a great presentation with my brain gal today, Stephanie Ramirez. And I think it's going to be a pretty relevant topic that most people think about, which is the aging brain. Is this normal or is it not? Right? So, I think we've all had those moments going, do I have Alzheimer's? Do I have a brain tumor? What's wrong with me? Am I okay? But we're going to learn today what is normal, what's not, and just about your aging brain journey. So a little bit about my friend Stephanie here. She's presented for us multiple times. So if you have not seen any of Stephanie's other presentations, go back to our YouTube channel and watch them because there's, countless. She's with us about once a quarter. So Miss Stephanie is a speech language pathologist here at North Kansas City Hospital. And she's been doing that since 2009 in various settings, primarily focusing on acute care and outpatient rehab with adults. In February of 2021, Stephanie founded the Virtual Brain Injury Support Group through North Kansas City Hospital here. And it meets monthly, and it's served over 45 individuals from Missouri to California who are recovering from concussions. Stephanie is passionate about sharing information and educating the community and has been a featured speaker at several conferences, including the KU Concussion Symposium, STEM Saturdays at Union Station, and the Kansas Speech and Hearing Association. Stephanie enjoys spending time with her husband and her two children, Owen and Mia, which Owen's going to be a Ghostbuster for Halloween. We were just talking about this. And Mia's going to be a witch with a broom.
Yes.
And then Stephanie also enjoys rooting for her alma mater, the Oregon Ducks. So please help me welcome Stephanie Ramirez. And I'm going to turn it over. Wait, I do this every time. Guys, the chat is open. Please throw questions or comments in there. Also the Q&A if that's more comfortable for you. And we will kind of fill those at the end. So be thinking of your questions. Okay, now take it away, Stephanie Ramirez.
Perfect. Thanks. I will get my PowerPoint pulled up here. And yeah, my Ducks had a really good win over the weekend. Ohio State, it was a great game. So if anybody is a college football fan, hopefully you saw that because it was a very exciting game. Okay. Okay. So yes, we are going to jump in. To a topic that I have lots of questions, or I get lots of questions about. And so hopefully we can answer some of those questions for you today. Just some background. I know Bree gave you some already, but I am the lead speech pathologist here at North Kansas City Hospital. In my off hours, I do volunteer as well through the Alzheimer's Association Heart of America chapter. I am a community educator for them, and I also MC their Walk to End Alzheimer's. And just a little plug, actually, this Saturday is the Liberty Walk to End Alzheimer's at the Happy Rock Park in Gladstone. So I will be there and hope that you all can join if you are available. It's a great cause. It's a great event, and still accepting people signing up and donations. And where I get my passion for this area is in 2019, I actually lost both of my paternal grandparents to Alzheimer's disease. That's their picture down there. And that's a little baby Stephanie. And, I think going through their journey and seeing what different experiences they had with the disease, my grandfather's was a lot longer of an experience while my grandmother's progressed very rapidly. And I think just working as a speech pathologist and working with patients with cognitive deficits, a lot of people get very concerned about this. And actually, Edward Jones did a survey, and I believe this was done back in 2020. So right when COVID was rampant, and they polled different retirees for what they were fearing most later in life. And the majority of people were concerned about their risk for Alzheimer's or dementia. That outranked cancer, it outranked COVID-19. And so this is definitely something that is on people's minds. And so before we jump into, some of our questions of the day, I just want to clarify some terminology for you. So you might hear Alzheimer's and dementia used interchangeably. Dementia is the umbrella term. So it's the general term for the loss of memory, language, or problem solving. And those changes and losses are severe enough to interfere with your daily life. Whereas Alzheimer's disease is the most common type of dementia, and that accounts for 50 to 75% of the dementia diagnoses that are made. There are other kinds of dementia, and you may have heard about these in recent years with different celebrities. So I believe Bruce Willis has come out with frontotemporal dementia. Robin Williams had Lewy body dementia. There's something called vascular dementia. So there's different kinds of dementia, but Alzheimer's is the most common. So some of the questions that I hope to answer for you today are: what is normal aging in the brain? And when should you be concerned? And if you have concerns, what should come next? I think everybody with a brain should be aware of these things. We generally say that 65 years and older, your increased risk of Alzheimer's begins. So anybody ages 65 and over, this should be great information. Okay, so getting into the aging brain. Just like any other part of our body, our brain does change over time, and we're going to talk a little bit about that. So when we think about the brain and age, atrophy or kind of a shrinking of the brain is the strongest correlate of age. So typically as someone gets older, their brain shrinks a bit, and we see that shrinkage in certain parts of the brain, and I've highlighted some of those here. So that prefrontal cortex, the green, and the hippocampus, which is that little blue area in the middle, and then the cerebral cortex, which is actually the lining all along the outside of the brain, are most commonly affected as we age. And those are the areas that are involved in complex thought processes and memory. So we see kind of a correlation between changes in the brain with age and some of those thought processes. More changes that we might see as someone ages, kind of the way the brain areas communicate, the way the signals are sent might be less effective. They might go a little bit slower. We might see blood flow to the brain decrease a bit. We also might see inflammation, and that can be due to different injuries or disease, which are obviously more common as we age. Other changes that can definitely impact our brain are things like fluctuating hormone levels. And when we think about, menopause and all of those things, definitely hormones are changing, deteriorating blood vessels, circulation of blood glucose. So diabetes can actually also affect how our brain works as we age. So different things to consider, but the main thing that we look at is basically our brain is part of our body. So a lot of times the health of our overall body will be a reflection of the health of our brain. And so the National Institute on Aging had a study in 2020 where they looked at 3,000 older adults, and they looked at different healthy lifestyle factors like physical activity, not smoking, not drinking heavily, following a Mediterranean style diet, and engaging in mentally stimulating activities. And what they found was that people who engaged in 4 or 5 of these behaviors had a 60% lower risk of developing Alzheimer's as compared to those who only followed 1 or none. People who followed 2 or 3 of the activities had a 37% lower risk. So really, things that you're going to do to help keep your body healthy as we age are also going to help your brain. And we're going to talk a lot more about different things that we can do coming up. Some more research to support this. In 2017, they did a large long-term study that showed certain heart disease risk factors in midlife, such as diabetes, elevated blood pressure, and smoking cigarettes, were associated with an increased risk for dementia. And in 2021, they did a study that showed that older adults with higher levels of physical activity had slower rates of cognitive decline than peers who were less active. So as our brain anatomy changes, as our bodies change and our overall health changes, we might also experience some changes in our thinking. So these are things that are normal as we age. So older adults may be slower to find words and recall names. They may have problems multitasking. They may experience mild decreases in the ability to pay attention or have a harder time processing new information. And I say may because it's not everyone. And, you know, we're going to talk about kind of where the line is drawn between these very normal age-related changes and then something you should be more concerned about. But the good news is that it's not just negative changes as we age. There are also actually a lot of positive changes. So going back to the research, studies show that older adults have larger vocabularies and a greater knowledge of the meaning of words than younger adults. Older adults may have learned from their many years of accumulated knowledge and experiences. And, you know, that's what I tell a lot of my patients who are coming in with memory concerns is that your intellectual ability, how smart you are, that's not going to change. That's not going to be something that declines. You still have your intellect, you still have your wisdom, your life experiences, your knowledge. What changes with things like Alzheimer's and dementia is how you can access those things and how quickly you can access those parts of your brain. And, you know, the thing to think about is you have all of this knowledge, but you have to apply it. And so the last point there, whether and how older adults apply their knowledge and how the brain changes as a result is an area that researchers are currently exploring. And the main thing that they're looking at, because I think all of us would love to be one of these people, are what they call cognitive superagers. And superagers are people who are 80 years old and older who have memory test scores that are comparable to people 2 or 3 decades younger. And so these people do not have the typical changes that we see in the brain as they age. So research is definitely going to be ongoing to understand what sets these people apart. And hopefully that will help others prevent or even reverse that age-related cognitive decline. So some of the things that they are maybe hypothesizing with this population is that the brain region that is important for integrating information related to memory, attention, cognitive control, and motivation was thicker in superagers. So maybe they're just born with this part of the brain that's a little bit more robust. They have higher density of specific neurons, which are linked to social intelligence and awareness. So that was kind of an interesting finding. And they have found that superagers experience less shrinkage of the brain or volume loss than cognitively normal adult brains. So we see 1.06% loss compared to the standard 2.224% loss in the average population. So why is that? And I think there's different theories and definitely some food for thought. You know, perhaps those people might start out in life with, you know, larger, stronger brains. Maybe their brains somehow change to compensate for the damaging effects of aging. And perhaps their brain has a stronger defense against the effects of aging. So the concepts of cognitive reserve meaning your brain doesn't break down as quickly, versus brain maintenance, meaning maybe your brain can compensate well or get around different problems that might come up, are two theories that kind of come with these superagers. So maybe it is something that is just nature. They were born at a predisposed advantage. However, the other side of things is the nurture side. So enriching experiences like in advanced education, mind-challenging occupations can help brains last longer. So a lot of these superagers had those things. Also, cognitive superagers reported more friends and family connections. So that really does support past research that shows a link between your psychological well-being and a lower risk of Alzheimer's. So definitely some food for thought. And while we cannot all be superagers, I think that it's important to remember that aging brains can still learn new skills. The old saying, old dogs can't learn new tricks, that's very far from the truth. Our brains are constantly learning, and we have that ability even as we age. We can still form new memories. We can still improve vocabulary and language skills. And so even if, higher education or cognitive exercises or learning a new hobby is not something that you've done in the past, it's never too late to start. And that's kind of what I want to emphasize today as well with all of the suggestions that I'm going to give you. It's never too late to start kind of building those good brain habits. So just to review some normal age-related changes, and these are ones that patients have specifically brought up to me as being concerning to them. It is normal to forget the date, but maybe remember later. It's normal to lose things, but be able to retrace your steps to find them. It's normal to sometimes forget what word to use or feel like that word is on the tip of your tongue. It's normal to forget maybe a monthly payment occasionally or make a bad decision. It's normal to feel a little bit slower and maybe have a little bit more difficulty with multitasking. I think most of the patients that I work with who have Alzheimer's will tell you, when you're thinking about dementia, when you're thinking about Alzheimer's, it's things that impact your day-to-day life significantly. And it's not just forgetting and it coming back to you later. It's a different kind of forgetting. It's forgetting and having no idea what it was or where it was. For example, my grandma lost the remote one day. We found it in the refrigerator. So definitely was not, a logical place to look for it. And she could not remember putting it in there. So, when we think about the changes and the warning signs, it is something that's going to be significant. However, when you see things or if you have concerns, I think my biggest piece of advice would be not to ignore them. So if you have a concern, if you have a hunch, whether it's yourself or a loved one, it's always better to be proactive and ask those questions than it is to just kind of brush it under the rug. So some things that would not be normal aging, we're going to talk about. So when we're thinking about Alzheimer's disease, a person, is probably going to be physically pretty healthy, but you might notice that they have more trouble just making sense of the world around them. And sometimes this realization comes on gradually. So you might not notice all of these things happening at once, but over time, you might notice more of them happening and more frequently. And sometimes the person themselves will recognize that, and sometimes they will not, and it's more the family and the people that are very close to them that notice those changes. So what would be some red flags that you would want to look for? Memory loss that disrupts daily life. So again, it's a different kind of forgetting. It's not just, oh, where did I put my car keys? And then you retrace your steps. It's, you know, the remote is in the refrigerator. Poor judgment, which leads to bad decisions. Unfortunately, a lot of people are victim to scams because they are, you know, not able to think as clearly through some of those, you know, judgment tasks. You might see a loss of spontaneity or a sense of initiative. My grandmother was very involved in bridge club and water garden club, and all of a sudden she just kind of stopped going to those things. So that was definitely a change for her. Completely losing track of the dates or not knowing where you are. So normal to get lost going to a new place. But again, just a personal example, my grandmother went to the same hairdresser for many years in her small town. And one time she was going, she got lost. And she had been going there for many, many years. So that was definitely a red flag. You might notice that the person takes longer to complete normal daily tasks. So those things that they were able to do before are now more challenging for them. I'm not saying if you were never good at math and now math is taking you a long time, that's not what I'm talking about. You know, we can't expect you to be, you know, faster at something that you weren't good at before. But if it's something that you were good at before, and now it's become more of a challenge, that's what we're talking about. You might notice also repeating questions or forgetting recently learned information, trouble handling money and paying bills. Again, if that's something that the person did, then and now they're having more trouble with that. If they never paid bills or handled money, then that probably wouldn't be something you could, you know, look at. You might notice challenges in planning or solving problems. Obviously, wandering and getting lost would be quite concerning. Losing things or misplacing them in odd places. Difficulty completing common tasks, such as, I'm going ahead. Sorry about that. Difficulty completing common tasks such as bathing. So you might notice a change in personal hygiene. You might notice a change in how they keep their house. Maybe somebody who had a very well-kept home, all of a sudden it's a little bit more cluttered. Things are kind of not cared for as well. So those things that they typically did quite regularly, maybe they are not keeping up with it as much. You might notice some mood and personality changes, increased anxiety or aggression as well. I think those things are also very common. You might notice also that those things get worse at night. Typically, we call that sundowning. So maybe the person's really sharp and good to go in the morning, but as the day goes on, you might notice more of those changes. So, you know, lots of different things to keep in mind, but when you're starting to notice things and you have concerns, now what, right? So when we're thinking about these things, I think the first thing you have to do is start a conversation. Because, you know, maybe the person has noticed it themselves, maybe they haven't. As a family member, you know, I think it's helpful to start out the conversation by just being clear about your intentions and saying that, you know, I love you, I'm here to support you, and I have these concerns, and these are things that are worrying me. Have you noticed this as well? And just kind of opening that up, that dialogue, and doing it in a way that the person doesn't feel like they're getting ganged up on or being accused of different things. Now, I think it's normal for them, you know, to be defensive. But I think if they know you're coming from a place of love and concern, then that definitely makes a big difference. once you have that conversation, the first step would be to talk to your doctor. I always recommend a second person go for support because not only is it a lot of information, but I think just having somebody there for that emotional support is really helpful. This can be pretty scary. So when you're preparing for that first appointment, it's important to bring a list of medications and supplements. That's one of the first things the doctor is probably going to look at because certain medications can change your cognition. And so they're going to look and try to basically do a process of elimination of what could be causing the things that you're noticing at home. They are going to do a medical history and a physical exam. They might do some different testing and scanning. So they might do some brain scans, and that would show the degree of atrophy or shrinkage that's happening in the brain. They might do some blood work, and they might do a urine analysis as well. One of the most common signs of a urinary tract infection is increased confusion. So maybe some of these things that you've noticed can be attributed to something like that as opposed to dementia. So they'll narrow it down and see what is going on. And then they might refer you to a specialist, such as a neurologist or a neuropsychologist, who can really look closely at the brain and see what their suggestions might be. Once you have talked to the doctors and they've determined, yes, it is dementia, or yes, it is Alzheimer's, I think it's important to, start out by creating a plan. Knowledge is power. So learning and researching, that's why we do these kinds of community education opportunities, because I think people need to understand and know what's going on with their body. The Alzheimer's Association website is an amazing resource for all kinds of information regarding a new diagnosis of dementia or Alzheimer's. They also have a 24-hour helpline, which you can call anytime, day or night, and I've actually got the number right there. There are lots of clinical trial opportunities if that is something that you are able to do. A lot of times those opportunities will give you access to the latest and greatest in new advancements and treatment options, and you'll get, top-notch medical care. The KU Alzheimer's Center has a lot of clinical trials happening, so definitely an opportunity to check those out. There's also different programs through the Shepherd Center, the Senior Center, things of that nature, if the person needs to be more engaged. And therapy, I'm going to make a shameless plug here. So as a speech pathologist, I work with patients who are experiencing cognitive deficits, whether it's from dementia or other things. And we can do exercises and strategy training and family education and all kinds of things to help, really get things going for that patient and make sure that we're able to preserve and protect their cognitive function. So I have listed our phone number is there down at the bottom. That is the main rehab number. And if you have questions or you want to learn more about how therapy can help you or your loved one, I'm more than happy to discuss that. Speech therapy for cognition, memory, problem solving, attention is usually covered by most insurances with a doctor's order. So definitely a benefit that you can take advantage of. The other thing to think about with a new diagnosis is safety. That should be the #1 priority. So we want to declutter the home, unplug the stove and microwave, reduce that fire risk, maybe get a personal alert button. Those are pretty common now. Make sure that all the rooms have good lighting so we prevent any falls. Keeping commonly used items within reach. If necessary, taking the car keys, and then thinking about, okay, when are we going to know that it's time for a more supportive placement? and kind of establishing that early on, because that can help take the burden off of those decisions later on. So these are all things that we did in my grandparents' house, and I think it's really what helped them stay in that house as long as they could. Understanding that you're not alone. It's really important to build that support system. So family, friends, neighbors, church family, anybody who's going to be involved, I think is good to kind of sit down and decide who's going to help with the daily activities, medications, finances, transportation, all of those things. And again, having those conversations early, even though they're difficult to have, I think it's important to have them early so that you can have a plan and really prepare for the future, because that will just decrease the burden later on. And I think the Alzheimer's Association has some really great kind of flow charts on their website as far as the questions to ask and the things to consider, so that you have all your ducks in a row and that you have everything kind of planned out. But I think it's important to remember as we get older, whether you get the diagnosis of dementia or not, it's important that we thrive. We don't just survive. So I wanted to talk about some things that can help us thrive well into our older years. And so this is from the National Institute on Aging. These are the tips and lifestyle changes that they recommend that will help you live longer and better. So going back to those original research studies, we want to build that brain-body connection. So doing things that are going to help our body, like movement and physical activity, and having a really good diet, managing our stress, going to the doctor regularly. Those are all things that are going to help keep your brain healthy. We talked about, things that are going to stimulate our brain, like learning something new, connecting with family and friends. So these are just some first steps that you can do to help promote healthy aging. And we're going to go into those in a little bit more detail. So when we think about physical health, obviously we want to get all of our recommended health screenings. We want to manage those chronic health problems like high blood pressure, diabetes, high cholesterol, because those we know can all impact the brain. We want to talk to our doctor about all of our medications, as I said, possible side effects of those medications, because if you're having some negative side effects, it's possible that there could be something else going on. We want to treat hearing or vision loss. There is a correlation with hearing loss and dementia. And again, I think there are multiple theories behind that, one of which is if you are hard of hearing, you're probably not able to socialize as much. You're not able to talk to other people and hear them well and engage in those conversations. And that's one thing that really is good for our brain. So treating those, sensory deficits that we can continue to engage with the world around us is really important. Reducing the risk for falls and other accidents. Certainly a fall can lead to a brain injury, or a concussion, which is also not good for our brain. Limiting alcohol and tobacco, and getting 7 to 9 hours of sleep each night. So all of those things that are good for our body. And then when it comes to diet, we're talking about eating lots of fruits and vegetables, whole grains, lean meats, fish, poultry, low fat or non-fat dairy, and limiting those things like solid fats, sugar, and salt. I believe we've had talks from dietitians before, and while I'm not a dietitian, these are just, some general things to think about. We want to make sure we control portion sizes and drink enough water. 64 ounces a day or 8 glasses a day would be ideal. A lot of people ask me about a specific diet that I would recommend, And in general, I just say a balanced diet. But you might have heard of the MIND diet, which is a combination of the Mediterranean diet, which was studied in some of those research articles I mentioned earlier, and the DASH diet, which is dietary approaches to stop hypertension. So again, kind of that heart health, body health equals brain health. So the MIND diet is one that has gotten a lot of buzz lately. But again, I think it's just being balanced with what you're taking in. A lot of people ask me if there's a vitamin or a pill, they could be taking. And right now, there is no vitamin or supplement that's recommended for preventing Alzheimer's or cognitive decline. If you do have the Alzheimer's or dementia diagnosis, there are prescription medications that your doctor might recommend to help slow the decline or help with some of those side effects of the disease process. And that's very exciting because up until, a couple years ago, we did not have anything that was going to help slow down the cognitive decline with Alzheimer's. But we do have, I believe, three new prescription medications now, and I believe most of them are administered through IV. And so that would be something to talk to your doctor about. But if you do not have Alzheimer's or dementia, there's no vitamin or supplement that is going to prevent that. But what research has shown is that just taking a multivitamin is good for you. And again, just thinking about overall health equals brain health. So just most of my patients, I just recommend, hey, just take a good multivitamin and that will be sufficient. When we think of physical activity, I know that it can be kind of daunting, especially if you have not been physically active. But I think just starting slow and working your way up, we know that physical activity can help maintain and improve your strength and help you have more energy. It helps with balance and again, preventing falls. It can help prevent or delay different illnesses like diabetes, heart disease, other disorders. It can improve your mood and reduce depression. So lots of benefits of physical activity. And you don't have to be running a marathon, right? So just aiming for 30 minutes a day, 5 days a week. And it can be walking, it can be swimming, it can be chair yoga, lots of awesome videos on YouTube that are totally free that you can follow along, low impact, exercises, sometimes just doing chores, housework, that can be definitely physically demanding. So just figuring out how you can get your body moving and kind of building that habit or that into your routine. Now, this is the area that's near and dear to my heart because this is kind of what we work on in cognitive therapy. Research has shown that cognitive training has benefits for maintaining cognitive health in older adults. So one study found that older adults who learned quilting or digital photography had more memory improvement than those who only socialized or did less cognitively demanding activities. They've also looked at different activities like music, theater, dance, creative writing, and those showed promise for improving quality of life and well-being, from better memory and self-esteem to reduced stress and increased social interaction. So a lot of these activities allow us the opportunity to engage with other people, which is killing two birds with one stone. We're going to talk about socializing next, but what we do in cognitive therapy, as I mentioned before, so we do exercises to help kind of engage your brain, stimulate your brain function and working specifically in those areas where you're having trouble. And then we also talk about different strategies to help compensate for different areas that are not working maybe as well as you want them to. And then, we brainstorm and problem solve through different challenges that the person's having in their daily life. And a lot of people really enjoy it. They think it's fun. They feel good about being proactive with their cognitive health. And we see good improvement. And it's something where, you know, a lot of times when people have concerns, sometimes coming in and talking to someone, having the testing done so you know where you're performing today, can help give them peace of mind for when they're down the road and they have something to compare it to. So just some things to consider. As I was saying, socializing, very, very good for our brains. So we want you to stay connected with your family, friends, neighbors. You know, high social engagement has been associated with better cognitive health later in life. A lot of my patients, I really encourage them to do things like volunteering, you know, or finding something that they enjoy doing, like walking. The Silver Sneakers Club is one that I've had a few people do, and they really like that. Scrapbooking clubs, bridge clubs. Bridge would be great because, you know, card games make you think too. So again, killing two birds with one stone. But you can find a lot of programs through the senior center. The public library has a lot of amazing programs. Churches often have a lot going on, other community organizations. And I think one of the silver linings of COVID is that a lot of things went online. So if you have, you know, limited transportation, you're not able to get out, there still are a lot of opportunities for online groups that allow you to connect with others from home. And lastly, we really want to look at our emotional health as well. You know, when we think about emotional wellness, that's the ability to successfully handle life's stresses and to adapt and change to difficult times. So, you know, those things include building resilience. So learning healthy ways to cope. Maybe that means that you are, you know, tapping into social connections in your community. Maybe you're talking to a counselor. Maybe you're practicing gratitude each day or taking time for yourself. But building resilience can help your overall emotional health. We know reducing stress is very important. You know, everyone feels stressed from time to time, but, you know, when we're stressed all of the time, then those changes in our brain, that kind of fight or flight response that we get when we're stressed out, it becomes chronic and it becomes harmful rather than helpful. So learning healthy ways to cope with stress can help build your resilience as well. So different relaxation strategies, exercise, you know, different things of that nature. We know quality sleep is very important for our emotional health. Just ask any new parent. And so I always recommend my patients try to go to bed and get up at the same time each day, really building that sleep routine. Limit use of electronics in the bedroom. And, you know, really talking to their doctor if they're having ongoing problems so those can be addressed. Another way to address your emotional health is to be more mindful. So just being aware of what's happening around you. I think a lot of times we're thinking ahead and feeling kind of anxious, or we're thinking back and feeling regret, but really being in the moment. And so just doing maybe some deep breathing, journaling, just really being present in the moment. And there's a lot of great resources online for different mindfulness programs that are out there, and a lot of them are free. You know, as we get older, it's important to cope with loss and healthy ways to do that. So if you need professional support, if you are, you know, interested in joining a support group, you know, talking to people, I think that always helps, and strengthening those social connections. So building relationships with your family, friends, if you're a caregiver, asking for help so that you can take some of the burden off of you, and, you know, really broadening your horizons by learning something new, joining different groups with people that have different interests, traveling to different places, meeting new people. Those are all great ways to address your emotional health. And the National Institute on Health, the NIH, has some wellness toolkits that are available. So if you go to nih.gov/wellness toolkits, you might find some really great resources. That's actually where I got a lot of this information on emotional health. And I think they have some really good other topics on there as well. So other resources that I wanted to leave you with, obviously North Kansas City Hospital, Meritas Health. We really try to do a lot of community outreach and just provide support and hope within the community. The National Institute on Aging has some great resources on their website as well as CCC. And then, as I mentioned, the Alzheimer's Association website is just got a plethora of resources and information that you can access, and you can also call that helpline 24/7. So that is my contact information. I wanted to share that with you. Feel free to call or email if you have any questions after this. That's a picture of my family at the Walk to End Alzheimer's a few years ago. But I wanted to stop there and take some questions and make sure we were able to address some of those today.
Thank you, Stephanie. Always learn so much from you. We do have a couple questions. Actually, one says, can you give a few more really specific examples of what is normal brain aging versus what is dementia?
So I think, we always kind of think in general terms. And so I think I've listed all of those out. I think if you have a specific question of is this normal, you could certainly talk to your doctor about that. I think, again, when we think about, the changes that's normal versus not normal, it's things that affect your day-to-day life. It's things that maybe your family and friends have noticed that they're concerned about, that is, concerning them. But if you have a specific question, I think I gave quite a few examples, so I'd be happy to address whatever the specific question was.
Okay. Yeah, and there's her email and her phone number right there
Yeah.
on the screen. So I think that's great too, because a lot of times it is very specific and it's
Yeah.
kind of eating you up that you have this question or this symptom and you're like, is this normal?
Well, I think my mom actually, what was it the other day? She was talking to me and she's like, Steph, sometimes I am in the middle of a conversation and I just kind of go blank, and I get really worried about that. And I'm like, no, Mom, that's totally normal. Like, it's normal to kind of feel like a word is on the tip of your tongue. It's normal, but it comes back later, typically. If you find that you can't think of the word you want to say and it's really impacting your ability to have conversations, then yes, that would be concerning. But every once in a while, kind of forgetting what word you want to say, I think everyone does that. So,
sure.
I think if you have specific issues, definitely a good idea to talk to your doctor.
Another question here. How much impact does diabetes have on brain health? It's a great question.
It is a good question. And I think that they've done a lot of research on that. I think, diabetes alone is probably not going to be impactful if you're able to manage it well, right? But if it's not controlled, we talked about like the blood glucose levels in the brain being off as we age. Certainly, if you have diabetes, that's going to affect it more. And especially if it's not controlled well, if you have really, really high blood sugar, that can cause can cause confusion. If you have really, really low blood sugar, that can cause confusion. So I think the general answer is if you have diabetes, you just need to make sure that you're managing it well. Diabetes will not cause Alzheimer's, but there is, definitely a correlation between having multiple chronic illnesses and then having more issues with your brain.
Okay. Someone wants to know, will we provide this presentation for future review? So we record this. This is being recorded right now, and we will put this on our YouTube channel. But if okay with Stephanie, I can link your PowerPoint in an email, and I'll
Mhm.
follow up with everyone that's registered, and we'll send that out. So
Yeah.
we'll do that. What is the latest information regarding potential connections between genetics and Alzheimer's?
Okay, so good question. I think that well, there may be new research out there, but the last time I went through the Alzheimer's training through the community education, the greatest risk factor for Alzheimer's was age. So it does not necessarily mean that that it's genetic. However, what they found was if you have an immediate family member, such as a sibling or a parent that had Alzheimer's, your risk is higher. There are different genetic tests that can be done. I don't believe they're done very regularly because I don't know how accurate they are. I mean, I think we all would love to have a crystal ball to say, am I going to get this? Am I not going to get this? But I think that's where just the awareness and being vigilant with our mental health, our cognitive health, where that comes in. But just because you had a family member that has had Alzheimer's does not mean you will get it. Age is the number one risk factor. And when I say age, it's 65 and older.
Is there an average timeline for progression of Alzheimer's once diagnosed?
So that's a really good question as well. In my experience, no, there's not a number where we can say, it's going to be this many years. I think certainly online you can probably look at the average. I think people progress through the disease so differently. As I mentioned, my family experience, my grandfather had the diagnosis for probably 7 years prior to his passing. I will say those 7 years were good years for him. He had a good quality of life. He continued to play in the community band. He continued to go out on the farms. And so 7 years, and really only until the very end did we start to see some more severe cognitive changes. My grandmother got diagnosed after a fall. She had a fall in November of 2018, went to the hospital, and they kind of were looking into some things. She got the diagnosis and she passed away the following May. So for her, and her cognition declined pretty rapidly. So I just feel like everybody experiences it differently. I'm sure there are averages out there, but the main thing that I want to point out is early diagnosis and early intervention, medical intervention, therapy can help prolong and really improve quality of life. So if you have concerns, it's never too late, but it's also never too early to ask those questions with your doctor.
Right. You've given a lot of examples of how to kind of delay that. And I think that's great. The social activity, the using your brain, using what you've got now, still getting into therapy. I was going to ask a question. Oh, do you think that we will see a cure for this?
I sure hope so. I think, I've been involved with the Alzheimer's Association. I was actually involved with them like long before my grandparents were diagnosed. And I remember going to the walks and, there was nothing. I mean, they really didn't have anything that was going to help once you got the diagnosis as far as maintaining your cognition. And they, just like I said, in the last couple of years have come out with these new IV interventions that if they are administered early in the disease process, they can really help preserve cognitive function. So I feel like that really has opened the door to understanding how the disease works and how we can prevent it from getting worse. It's always like a very powerful moment. You can see in the picture there, we have the colorful flowers. Those represent different connections to Alzheimer's. So whether you're a caregiver, a person who has the disease, but there is always one white flower that we hold up at the walk, and that represents the first survivor. And so I think that's why we continue to do those, volunteer work, fundraising, so that we can help support, the research that's really going to help get us our first survivor.
It's a cute pic. I like that.
Yeah.
You guys had great questions today.
Yeah.
In the chat, I did link the NIH.gov, the wellness guide. Somebody asked for that. So if you click that link within the chat, and then please jot down Stephanie's email and her phone number. And does anybody else have any more questions? My gosh, we were just.
Yeah, great questions.
I love it. Okay. Well, again, we will be in contact with you guys regarding this PowerPoint and email a link out for the YouTube video so you could rewatch if you wanted to. And thank you, Stephanie, as always.
Thanks. My pleasure. Everyone have a great day.
Yeah, have a great day, and thanks for joining us. And please go back to nkch.org and check out any further presentations we may have coming up. And Stephanie will be on the schedule. I think January we've got another one. So you guys have a great day. Take care.
All right. Thanks.